Folk Oncology, H-4-P-E, Oncology Clinic in Bhoskas. And he's also associated with Pushpabhati Singhania Research Institute in Sheikh Sarai, where he admits his serious cases, as you are aware. Many oncology cases, they need admission from time to time because of various issues that develop during chemotherapy. He completed his MBBS from University of Mumbai in 95, DMB in Pediatrics from NRCH, New Delhi in 1998, and DMB in Oncology from the prestigious All India Institute of Medical Sciences in 2003. He is a member of the European Society of Medical Oncology and Indian Society of Medical and Pediatric Oncology. Some of the services provided by Dr. Amish Vora are head and neck tumors, cancer surgery, PICC line insertion, breast cancer treatment, breast cancer management and chemotherapy of solid tumors. Dr. Vora has a holistic center and a very holistic approach to cancers. He has a state-of-the-art center in Bhoskas. I would request all of you, and God forbid that you ever need it for yourself or relatives, just see the center to believe its beauty and the way he is conducting himself and his team. They are doing wonderful work there. Over to Dr. Amish Vora to enlighten us about the incidence of cancers in the young, and that is, I think, the foremost cause for depression in young people.
Thank you, Chauhan sir, for such an elaborate introduction, and thank you, Almas sir, for inviting me and giving me this opportunity on this holistic day. I am very happy that H in Hope stands for holistic oncology, as Chauhan sir said. And apart from DNB in pediatrics and medical oncology, I have also done MD and DM in medical oncology from All India Institute. Thank you. Today's topic which was given to me is cancer in youth. So now, first of all, I always wonder that what does youth word mean? कहाँ पे youth ख़त्म होता है? 50 साल पे, 60 साल पे, 65 साल पे, 70 साल पे? We really don't know. A person is youthful as long as he or she internally feels that they are young. But we need to have a definition, and the definition which is accepted worldwide is age group between 15 years to 39 years are called as young adults, and this is where the cancer in youth defined across the world as. Again, I repeat, 15 to 39 years of age. After 40, you are called as senior adults. So before I move on to my next slide, I heard Dr. Manish's lecture, and someone was asking about the research. In fact, there is a phase 3 study done in cancer where chemotherapy-induced neuropathy. Acupuncture is the only methodology which has reduced the symptoms. There is nothing else which works in chemotherapy-induced neuropathy but acupuncture. It is as close to as what we can get. Another thing, what diet and exercise we are doing, and next time in holistic probably we'll present that. But Dr. Manish, you have enough research, and congratulations on your achievement. Coming back, youth is 15 to 39 years of age, and this is what we see, that 40%, if you see right from 1975 to 2015, 15 to 39 years of age group, there is a 40% increase in cancer incidence. Some of the cancer registries mention increase of even 70%. So that what it means is that almost double the number of patients in last 25 years belong to age group of 15 to 39 years of age. Which are the cancers on rise in youth? So basically there are 14 cancers which have been diagnosed that their incidence has increased. One is breast, very, very common in young age now. Second is colorectal. In fact, colon cancer is increasing by leaps and bounds today. Endometrial, esophagus, bile duct, gallbladder, head and neck, kidney, liver, bone marrow, pancreas, prostate, stomach and thyroid. Now, one of the most important thing, and we are going to discuss this in little bit of detail, what is the common in this slide if anybody puts attention to this? 8 out of 14 cancers of these are in the digestive system. If you see, 8 out of 14 cancers belong to GI tract or the digestive system, what we call. So if it is digestive system and 8 cancers, you can imagine that the diet and lifestyle are probably the reason we have this. Second important thing in digestive tract, and which is a newer thing, I don't know how many of you have heard of stool transplant, right? So it is, stool transplant is coming in big way in multiple diseases. In cancer also, the stool transplant is coming up. What is this? This is the microbiome. What is microbiome? Microbiome basically is nothing but it can be bacteria, fungi, viruses, which creates an inflammatory milieu in your body. You are exposed to bacterial infection, you develop antibodies. You are exposed to viral vaccine, you develop antibodies. And these antibodies are responsible for not allowing diseases to proliferate in your body. So microbiome is going to be a next big thing in next 10 to 15 years. And what we understand, each person, like the DNA imprint, they have a different microbiome. So my microbiome would be different from Chauhan sir's and would be different from all of you. And probably this is going to give us many answers in future, which is why one person gets and why other person does not get. So the question always is why? Why 15 to 39 years age group we see so many cancers? Please understand, there is no one specific answer to this. Everything what is said, either you are compared with 1950s and 1960s of the world, or you have some association. We still don't know the true answer that why this cancer incidence increases, but it is multifactorial. First is sedentary lifestyle in urbanized society. There is Memorial Sloan Kettering Cancer Hospital, New York, the head of the department in one of the YouTube videos has said, we just drive everywhere. We no longer walk. We keep driving. एक जगह से दूसरी जगह जाने के लिए सिर्फ कार का यूज़ होता है आजकल. So sedentary lifestyle in an urbanized society. Lack of sleep. How many of us have 7 to 8 hours of sleep, which is actually required? And I am very happy sir has raised his hand. मुझे जिस दिन 8 साढ़े 8 घंटे नींद आती है ऐसा लगता है वाह, today something. It is I think more of we have made enemies of ourselves. Ideally 8 hours of sleep is genuinely required for the body repair mechanism to happen. More processed food and red meat, lot of meat consumption, especially in a Western world, which is there. Alcohol and tobacco, they don't need introduction. Anxiety and stress. I still remember that in one particular day in the OPD, I had 9 breast cancer females, less than 40 years of age. And 9 out of 9 had some catastrophic event in their life. या तो हस्बैंड की डेथ हो गई, या बैंकरप्ट हो गया, या बेटे की डेथ हो गई, या कोई मेजर upheaval in life आया, and suddenly they were diagnosed. Again, we don't know whether it is the causative effect, but stress does increase majority of the diseases in the body, and it is true for these young people also. I'm beyond 39, so I'm calling them young people, although I still believe I'm young. This is very interesting. Right from my MD and DNB days in pediatrics, I was told against cesarean section. And we always believed that, we have seen the seesaw change. There was hardly any cesarean section in 1950s and 60s. Then 1990s, if you see, the comfort of the female or the pregnant mother came into the picture and cesarean section started increasing. And now again what we are seeing that C-sec incidence is reducing. What they found was in 2023, this was the study done, and they found that children born by cesarean section have an increased likelihood of cancer. And again, the culprit probably is in microbiome. In the vaginal delivery, you go through the vaginal canal, which is full of microbiomes. The child or the fetus now becoming a newborn is exposed to that microbiome environment, develops the immunological phenomena, and probably has a long-term protection against many of the illnesses. This is again, as I said, assumption, a theory, but this is something, an observation, that children born with C-sec had a higher chance of having cancer, and even in leukemia it was seen. So okay, we say problem is there, incidence is increased. How do we treat this young patient? Memorial Sloan Kettering Cancer Hospital, New York was the first hospital in the world who understood this problem, and they have a separate department. The way we have a pediatric department, the way we have a geriatric department, they have a department of cancer in young adults, and these people see only patients between 15 to 40 years of age. They don't see younger patients, they don't see older patients, because it is very clearly, somebody who does diabetes throughout the life, somebody who does thyroid throughout the life, somebody who understands only osteoarthritis throughout the life, they will do a better job compared to someone who's seeing everything. So they are the first group which came. Now, what are the issues that are different from other age groups? Should they be treated with children protocol, pediatric protocol, or adult protocols? That is one of the first thing which is there. Second important point, people used to remember that day one of diagnosis. Remember, you are 16 to 30 years of age. What are the dreams we carried? We carried a dream of building a career, buying a house, getting married, or having girlfriends, or achieving something in life. Suddenly, when you are diagnosed with cancer, these dreams are shattered. This is the most important thing which in this age group is there. Second most important thing, physically, if the cancer can be cured, the most important thing in this age group is long-term side effects of the treatment. You have cured lymphoma in a 30-year-old patient. Patient is going to live till 80 years of age, remaining 50 years of life. What are you doing? So I'll give an example. There is St. Jude's Children Cancer Hospital, which is supposed to be the best cancer hospital for children in the world without any problem. Maximum children who were cured of cancer became criminals in the society. So they found out that why did they turn into crime if they were cured of cancer? What they found, that they were pampered a lot. For 1 to 2 years of treatment, the children were pampered to the extent they could not go back in the society and adjust. They were no longer, they said, oh, aaj koi mujhe dekhne wala nahi hai. Similarly, in this age group also, if you are going to give them 40, 50 more years of life, you have to have their quality of life intact. This is different from a 70-year-old patient. This is different from a 5-year-old child. In this age group, it is the unique thing. If you are going to cure cancer, you keep the person intact. So it's a very, very common example, colorectal cancer. This is the largest peak in young people in terms of colorectal cancer. Is 47% increase in the incidence in this age group. It is estimated by 2030, colorectal cancer incidence is going to surpass the breast cancer incidence also. The stage 1, stage 2 and stage 3 colorectal cancer can be cured, completely gone, disappeared. But we were curing so far by surgery, chemotherapy and radiotherapy. Assuming a 33-year-old male diagnosed with rectal cancers 2, stroke 3 can be cured of cancer. But majority of them, those who are suffering from rectal cancer, will have permanent stoma. You have a permanent stoma bag for next 40-50 years of your life. You have sexual issues because you have given radiation to the pelvis. You have infection rate, peritonitis, urinary incontinence. Somebody will ask, I have issues with sex, I have a permanent stoma. What the hell am I doing? My cancer is cured, but what type of life am I living? So then question is, what is the solution? And this is 2024 and this news is floating around from 2022. 100% of cancer patients, and trust me when I say this, I never thought in my lifetime I will use the word 100% in cancer. 100% of cancer patients cured long term in remarkable human trial. So a 33-year-old rectal cancer patient can be cured without chemo, without surgery and without radiotherapy. How is this possible? I have talked on immunotherapy on many forums. This may sound like repetition to many of you, but this is miracle of my generation of oncologists. So using immunotherapy in a particular subset of rectal cancer patients, these are the patients where on biopsy you have a microsatellite instability high tumors. What is MSI? Our DNA gets damaged every day. It needs to get repaired. And body has a mechanism where it repairs every day. When the repair mechanism is defected, we get more chances of cancer, and in these patients immunotherapy works better. How immunotherapy works? It activates your T cell action in your body, also activates the memory of T cells. So in future, this memory will kill cancer. So this is the miracle where at the end of 3 years, not a single patient has relapsed on immunotherapy in rectal cancer. What about other cancers? One of the common cancers in childhood or in the young youth, that is leukemia, are treated with pediatric protocols which are aggressive, and cancers which are common in senior like breast cancer are treated with adult protocols. Of course, some modifications are appropriate. Breast cancer in youth, they are very aggressive. A common misconception that breast cancer in young, it is very aggressive. It can be familial in origin, so that every patient is recommended to have genetic testing done. And in case if these genetic testing are positive, then you may be required to undergo removal of both the breast, removal of both the ovaries, and your oncologist will tell you, so that you do not get cancer in future. And mammogram is very, very common in older age group, not so in young age because of dense breast, and that's why MRI of the breast is resorted. This, I'll spend just 2 minutes on this slide, and I think I'm last 2-3 slides. I can see some of the boring faces. So, fertility preservation. India mein, ever since I am in AIMS, the doctors who are non-oncologists, when they refer cancer patient to me, they say, Amish, zinda rakh le pehle yaar, fertility baad mein sochna. Please don't do that. All those who see patients and they get cancer patients, please remember, except for leukemia and some very aggressive lymphomas, all other cancers can wait for 15-20 days to start the treatment, so that you can send these young boys and girls to fertility expert, and they can preserve either their sperms or eggs or ova, so that in future, when they want to become father or mother, these fertility preservation techniques will come handy. Chemotherapy kills majority of the sperms and ovas, and a person will become impotent if you do not do this. Again, I would say, a 30-year-old gentleman, you have cured of lymphoma, 35 साल का हो गया, बाप नहीं बन रहा, 40 साल का हो गया, बाप नहीं बन रहा. And at the end of 40 years, he will come and haunt you saying that, sir, मैं तो नादान था, आपने क्यों मुझे नहीं बताया? So this fertility preservation is mandatory for us to recommend to the patient in the age group if they are fertile in that age group. This is again a very, very important issue, and all of us can help in this, if not anything else. I remember when I was in Tata Hospital, majority of the Bollywood celebrities would come and all of them would want to spend time with children. छोटे बच्चे को गोदी में ले लेंगे, दूसरे दिन मिड डे और आफ्टरनून में उनका फोटो आ जाएगा. But I always used to tell them, please spend time with a 25-year-old guy or a 30-year-old girl, because their dreams are shattered and they require the most support of yours. Depression rate in this age group is more than 70%. This is a documented and proven CDC-defined depression. Refusal of treatment because of hair loss. 12% of these young people who can be cured of cancer, they refuse treatment because they don't want to have hair loss. Suicide rate, we really don't know, but ranges from 6 to 10%. Divorce rate is 20 to 30%. In India, more than 50% of lower socioeconomic strata, they get separated from their spouses, but it is not documented in terms of divorce. Nearly 80% people in India lose their employment willingly or unwillingly. What can we do as a society? This is my second last slide. We support them. We don't discriminate them. We understand their issues and give them helping hand. Guide them to the right doctor and the right hospital. Just be there for them. That is what they require. But in spite of these incidents, the good news is that the mortality, because of advancement in the treatment, the mortality because of cancer is steadily declining in last 10 to 15 years. Thank you so much. Thank you so much.
Very young. It leads to depression not only in the patient, actually it is a cause for depression in the entire family household. And we have seen at times that one of the parents commits suicide.
Yes, sir.
And you have brought it out at many times. The message should be that it is not only about treating that patient in question, it is about keeping a very, very vigilant eye on the family. Your comment on that?
No, sir, absolutely spot on, sir. We have to treat the entire family and not just the patient. I completely endorse and agree with your comment, sir.
August.